Welcome everyone to our second virtual session of Leadership Southeast Georgia 2020. I hope that everyone, okay, let me just jump in at this point and remind everyone to please mute your microphones real quick. And we will dive in. I'll give you a few housekeeping and technical tips as we get rolling. But just want to welcome you to virtual session number 2 of Leadership Southeast Georgia 2020. I'm Suzanne Kirk, the program facilitator, and I'm delighted. Looks like we have 27 people joining us live this morning, and I hope you are all safe and healthy and doing as well as can be in these very unprecedented times. So we are going to kick off with this session first with a few housekeeping things. If you go to the top of your screen where it says view everyone, if you click that and say view active cameras, then only our panelists and myself as the facilitator will be on camera, and that way you don't have to scroll through all of our participants to see who is talking. So that means that we would ask all the other participants joining us live to please go ahead and turn off your camera. Please be sure to mute your microphone as we are recording this session for our class members that can't make it, as well as for our alumni and board members. So thank you again for being here today. So last week we had our first virtual session of Leadership Southeast Georgia 2020, and we had 2 employment attorneys speak with us, Wade Herring and Sarah Lamar from Hunter McLean, talk to us about some of the HR implications that we're facing, both personally as professionals and in our business community. And they helped us navigate some of the changes to the FFCRA, the emergency extension of the Family Medical Leave Act. We talked about changes to Department of Labor unemployment insurance and just the unprecedented numbers that we are seeing that continue to rise about the Department of Labor unemployment insurance process. So that was session number 1. If you missed that session, it will be made available to you via a link because we are recording all these sessions. Also, please go ahead and mark your calendar for next Thursday, April 16th. Also at 11 a.m., we will have another session of our virtual Leadership Southeast Georgia 2020. The board and myself and our administrator, we are doing all that we can to bring you as much of the experience of this class as possible through these virtual sessions. So we really hope that you'll take advantage and hear from some of the great speakers that are so kind to join us as those we have this morning. So over the past couple of years, setting the stage for today, we have added to the ELSEGA program the objective of understanding how the local, state, and federal entities come together in both disaster preparation and disaster response. Historically, when we added that objective a couple of years ago, it was in the context of hurricanes. And I don't think anybody could have anticipated that we would now be talking about this process and this dissemination of information and how we communicate in context of a global pandemic. But that is precisely what our objective is today, is to really take a peek behind the curtain, if you will, to understand what is that flow of information, knowing that this information changes so rapidly, daily, sometimes hourly. How does that process occur? And so we will be exploring some decision-making processes as well as the dissemination of information and who plays what role at various levels of our local, state, and federal representatives. And so we are very fortunate to be joined by our distinguished panelists today. And to introduce those, I'm first going to introduce Jared Downs. Jared is a board member of Leadership Southeast Georgia. He is a graduate of the ELSEGA class of 2015, and he's currently the Director of Governmental Affairs for the Savannah Chamber of Commerce, and previously was the Southeast Georgia Regional Director for Senator Johnny Isakson, representing a 48 county area that he helped support. So Jared, I am going to turn it over to you to introduce our panelists, and then we will dive into some questions. A side note.
The headphones and put those in your ears because that's how you're going to talk or listen. Okay.
Okay. So as we get everyone set up to dive into introductions and questions, please note to the class that in the top right-hand corner of your screen, you should see a chat bubble. And that chat bubble will enable you to ask questions that I can ask on your behalf. You can set it so those chat questions come directly just to me, so they're private questions, so don't be shy about asking your questions. And so just a reminder to everybody, unless you're speaking, if you could please mute your microphones and your video. You can turn on at the very top, view active cameras only. And so with that, Jared, I will turn it over to you to introduce our panelists, please.
Thank you, Suzanne. So just joining us now is United States Congressman Buddy Carter for Georgia's 1st District. Thank you, Congressman, for joining us today. And then we've got Jonathan McCollar, the mayor of the city of Statesboro. Thank you for joining us as well. And Stephen Sains is state representative for District 180 and also a Leadership Georgia class of 2018 graduate. And side note, in 2018 was the same year he was elected to the state house. So good things happen when you go through Leadership Southeast Georgia. But I'll turn it back over to Suzanne.
Great. I'm glad that you give full credit to the Leadership Southeast Georgia program for that accomplishment. Thank you very much, and congratulations, Stephen. So thank you again for joining us all today. So we have a list of questions, and just a reminder to the class, please go ahead and use the chat function to jump in and ask your questions. But as I described this, it's designed to be kind of a peek behind the curtain of how does this flow of information occur. If we think about from the president on down to our local and community officials, what is that flow of information? And so I guess, Congressman Carter, if we could start with you, help us understand from your role, what is that flow of information to your office? And then in turn, what is your process of disseminating that information to the public?
Well, certainly the coronavirus task force is where we're getting most of our information from. That is where the policies and the procedures that we are following, that we are communicating, disseminating, that's where they originate from. And although it may be hard for people to believe this, I suspect that Donald J. Trump is really driving the car here and navigating this ship. And that's okay. I think he's doing a great job. These are unprecedented times. These are uncharted waters that we have never been through before. None of us on this call have ever experienced anything like this before. There's not a playbook. There's not anything for us to go by. I really do appreciate the expertise that has been given by Dr. Fauci, by Dr. Birx. I think all of them have done an outstanding job of leading us and helping us to flatten that curve. And that's really what we're trying to do. And I think the administration has done a pretty good job of delegating and allowing states to handle it. There was a lot of talk about having a federal shelter in place and having it federalized, if you will. I personally thought that the decision to allow the states to make those calls was the right decision, because what may be right for Georgia may not be right for West Virginia or for Idaho or some other states. So I do think that, and I've always felt like the best decisions are made closest to the people. So having those decisions made by local authorities is very important, in my opinion.
Absolutely, thank you. So with Congressman Carter getting his information really from the task force and looking at that and passing it along, then let's come to you, Stephen. So your role in your community, in the district that you serve, where do you get your information, and how does information flow to your office and from your office out to your community?
Sure, and I'll echo the statements of Congressman Carter that these are unprecedented times, which also means there's not a communication structure in place for items like this. The first step and issue we had on just a technical level was our staff, our House staff, which are minimal, but they were the first because of Governor Kemp's teleworking policy that was pretty early on for state employees, which the House and state Senate followed. We had them working from home even before we were out of session. That was about a week of just technical aspects of having phones roll over, and I know many folks have probably faced that same experience with their businesses. In response to COVID, I know a lot of coastal communities have an emergency operations center, really more in line with responding to a hurricane. So we assessed early on as a county delegation, which includes State Senator Ligon and State Representative Corbett, that we wanted to make sure to provide as much support on a local level on what we knew on a state level. So we've the weekly calls that the 3 counties that I'm in the district, Ware, Charlton, and Camden County, we've attended those, and really just a official or unofficial pathway on issues that are coming up from a local level and then down. And I think the major transition's been since Governor Kemp has ordered that statewide shelter in place. And I know the mayor might have some more details on kind of the transfer from local control and local decision making to mitigating what the state has requested.
Absolutely, thank you. So Mayor McCollar in Statesboro, describe us, same question, describe for us how you get your information. What does that process flow look like?
Well, for us, I think that we get our information from varied buckets. I'm part of a national organization that represents mayors at the federal level, so we get information from that bucket. Then we get information from the state level as well. So we're on the calls via GMA with the governor and Dr. Toomey and other members of the Department of Health. As well as we have a local think tank as well in regards to this matter. So what we try to do is try to consolidate and take the best practices and the best information from all of those buckets and try to do what's right for the city of Statesboro. And what we're real fortunate in is that we've got some great individuals that understand what policy looks like once you pass it at the grassroots level. So we feel that for the city of Statesboro, we've been just a step in front of the trends that's coming down out of the governor's office. So we feel that we are heading in the right direction. We just want to make sure that we get all of the resources at this point that's been passed via the stimulus package down to those local businesses so that we're able to save those businesses, save jobs, and then lift some of the burden off of the local families that we have.
For sure. Thank you. And Jared, how about you in your role in governmental affairs with the chamber? Is it a similar process to Congressman Carter with the task force information and what Representative Saines described with weekly calls and such, or are you in a different place, a link in that chain of communication?
It's very similar. We also rely on the Georgia State Chamber and also the U.S. Chamber of Commerce. They have larger staff and access to more resources, and so they help us in disseminating the information. They put together a lot of useful papers and stuff that we can pass on to our membership to help them navigate these times as well.
Absolutely. So we've heard about some of you getting your information in your official capacity with your task force calls and your weekly conference calls. I'm curious, where do you all go personally? I mean, there's so much information out there. We're inundated. Do you turn on the national news in the morning? Are you reading through the headlines on CNN or Fox News, or where are you each getting your own personal information? Congressman Carter, what do you do when you get up in the morning?
Well, we have a all-staff conference call every morning. And since this has been going on, we normally have them once a week when we're not in a pandemic. But during this pandemic, we're having them every morning. And of course, we go over information with that every morning. And of course, my day is full of conference calls, as you can imagine. And a lot of them are with different committees that I'm on, with the conference itself, with the Republican conference, with the WHIP team. I'm a member of the WHIP team, so we have almost daily calls. I'm a member of the HEAT team, the House Energy Action Team, which I don't know if a lot of people are aware of what's going on with oil right now and with the problem. I suspect there are some people who do know that we're having the price of gasoline has obviously dropped, which is good for the consumer. However, the demand has dropped as well because nobody's going anywhere. So that, coupled with the fact that we've had an increase in production of oil between Saudi Arabia and Russia, and now they are fighting, and that's caused a glut in the oil supply, and it's impacting American oil companies. So we've been very active in that. But I'm an avid Fox News watcher. So, and of course, I have a cell phone like everyone else, and I get notices just like everyone else. But most of it comes from our staff calls, and of course, I'm on communicating with my staff all day long.
For sure. What about the rest of you? Any other sources that are your go-to every day? that you
I'll
want
say
to?
I learned how to use Twitter through all this just because I and followed all state journalists and a few national ones just because it has been a really good tool to get live updates. And I have tried not to miss a single Rose Garden conference press conference just because it really tells you both what's being thought about before policy gets enacted, but frankly, kind of entertaining at some points too. But that's been something just on what available to all that has been pretty informative on the national climate, because I don't think it's important to not just look at the newsletters and the emails that we're getting on the back end, but be aware what constituents are hearing to mitigate those concerns that are coming to us.
For sure.
Okay.
What about those in rural areas? So how do we get information, necessary information out to folks in rural areas, or just those with lack of technology? They don't have access to technology in their homes, or it's just not a reality in their world. How are we getting information out to people throughout our state that aren't inundated with information through technology because they frankly just don't have it?
Well, I think one of the unique things that the city of Statesboro has done is that we've created Wi-Fi hotspots across the city. And it's a direct result of this pandemic. And so what we've done is we've identified areas where individuals could come and actually connect to those hotspots so that they can get information. But more than that, with the young people being out of school, we wanted to provide areas so that they can still continue their educational process. But beyond that, what we recognize is that the messaging is not going to be able to get to everyone because not everyone has the technology. So we try to get the information to those connectors, those individuals that may be ministers or leaders within the community that's going to be able to touch as many people as possible. So what we do with our public information officer, she puts out pretty much daily briefings as far as COVID-19 and different resources that's within our community. And then additionally, we have a great VOAD organization, and VOAD is organizing volunteers throughout our community, and so they're helping us to disseminate information as well.
Okay. Congressman Carter, can you weigh in on that question as well?
Actually, I can, and I'd like to, because it's a really good question. Keep in mind, although we do have Savannah and Brunswick and Waycross area, we've got a lot of rural areas in the 1st Congressional District. So this is a question and a concern that we've had come up quite often. How do you get that information out to those people? And particularly when there are a lot of areas that lack broadband, that lack internet access, even within our own district. And as hard as that is to believe, you would think that in this day of time, everyone would have access to it, but they don't. And some of them choose not to access it. Some of them, particularly a lot of the seniors, just choose not to use those. But we do, one thing that I would encourage everyone is to visit our website. It's buddycarter.house.gov. We put all the information on that website. It's a great resource. But what I want to mention here is what we did in the CARES Act. Remember, the CARES Act is the Coronavirus Aid Response and Economic Stimulus Act. And what we did in that act is that we actually put money toward telehealth. Now that's going to be very important in our rural areas, because there are a lot of rural citizens who don't have access to healthcare services, but they can be treated through telehealth. So we really did address this in a number of different ways in the CARES Act and in the coronavirus relief package, by allowing physicians to be able to use this, even to the point where they can use FaceTime now, even the point where they can be compensated for using FaceTime with patients. That achieves two different purposes. One is that it allows people access to healthcare. The second is that we don't want people in emergency rooms right now. We don't want them congregating in areas like that. We want them to stay sheltered in place. So that allows it to do that. The last thing I'll mention about the CARES Act and how it relates to the rural areas is that we actually put $100 billion in there to be used for rural broadband and internet access to extend those services to those rural areas. Now, obviously, that's going to take time, but I appreciate the mayor mentioning the hotspots, because that can be used for areas just like that, and that's what we want it to be used for.
For sure. Stephen and Mayor McCollar, what else are you all seeing in your communities about how we're getting information to those that maybe are not technologically able to get to it?
Sure, and I'll say this really emphasizes the need for statewide attention on our broadband infrastructure. We had a failed bill last year for 3 years in a row. The House Rural Development Council has requested broadband as a top priority. There's been items done in the bill to really what we need to do is create a funding revenue for it. I think if folks saw that Netflix tax that got reported through the media, a little bit misguided. I don't think anyone would be disagreeing on the need to improve that infrastructure more because we're relying on it in an increased level. Mayor McCollar's reference to the VOAD group is a great and a federal program implemented locally. They've identified seniors who can even pay for their food, but are really being incentivized and prefer to stay at home. Many of the folks that have called for assistance can pay for the items, but they can't use the platforms like the that you can online or by your phone buy groceries. So they're trying to create a phone line system of ordering food and partnering with a local IGA store to do that. So simple things like that. Really, there is no great way to communicate, in my opinion, without the internet at this point. So those populations, whether they're in rural areas of our communities or part of the demographics that just don't have the knowledge or preference capacities to use it, is definitely a vulnerability at this point.
Well, for sure. We're talking about access from a technology perspective, and that was one of the questions that we got on the chat. And a related question is just about disparities in access. So the access to the healthcare, and we talked about telemedicine, but also just options for groceries. We've got folks in our communities that are in a food desert without access to healthy food, and it's frankly getting scarier and scarier to go to the grocery store these days. And so what are the plans, what are the resources in place for those that maybe are living in a food desert?
This is where VOAD comes into play again. These are individuals that's and we have about 100 of those individuals that signed up to be volunteers within our community. And so they're the ones that's going out and touching those that's in the most vulnerable situations as it relates to this, which is what we see is those that's maybe coming from a lower socioeconomic background, as well as the elderly as well. So these individuals are tasked with going out and touching those people. But at the same time, when we think about our communities, we have to think about them in a comprehensive fashion. And so as it relates to internet, we have to start thinking about our internet the same way that we think about our highway and road systems. Just like we have roads going everywhere, we have to think about how do we get our internet. That's the new infrastructure piece that we have to begin to think about. And that funding has to begin at the federal level so that those of us at the local level can use those funds and get them into those critical areas. Additionally, one thing that we did is that we kind of turned back the hands of time as well. About 2 months ago, we bought into the Code Red system. And what the Code Red system allows us to do is to ring about 40,000 phones that's in Bullock County. So we went, we kind of turned back the hands of time and said, well, if individuals do not have, if they don't have internet access, if they don't have smartphones, then more than likely they have a telephone, whether it's a landline or a cellular phone. And so what we do is that when it's time for us to put out mass communications, we utilize that tool to be able to communicate with people on a mass level.
Absolutely. So we're talking a lot about current state, and some of the questions that we're getting are about future state. So knowing none of us have a crystal ball, unfortunately, and promising that we're not holding anybody to any projections as to what they see coming, but what do you each foresee our current state being in 30, 60, 90 days, and then even a year from now?
Well, if I could comment on that real quickly, I think the next 10 to 12 days will determine that. I don't know about y'all, but I'm starting to get more optimistic as time goes on. I think we are flattening the curve. I think what we're doing is working. And as difficult as it is for, to shelter in place and for us to be disrupted and to see our economy suffering like it is, what we're doing, I think, is working. So I'm very optimistic. My hope is that what we're going to see, first of all, is that we're going to see the health of our citizens, which is the primary focus of everyone, whether it be federal, state, or local. Everyone wants to make sure that our citizens are taken care of health-wise. But secondly, we're concerned about our economy as well. And we want to see a V-shaped rebound. We were very fortunate to have the greatest economy we've ever had when this happened. I only shudder to think what might have happened had our economy not been as strong as it is. But we had a very strong economy, perhaps the strongest ever. Now we want to see, hopefully, a V-shaped rebound. And 30, 60 days, 30 days, I'm not sure obviously we're not going to see a lot of change. 60, 90 days, and certainly by the end of the year, I hope that we're going to be well on our way to that V-shaped rebound for our economy.
And one of the
What about
things,
you, Mayor McCullough or Jared?
Well, I'll chime in, and I'm having that same optimism that Congressman Carter is having as far as the economy. I think one of the key things that we have to do now is that we have to be extremely measured in our approach. And I could tell you, as the mayor of a small town of about 30,000+ people, our economy is really based on Georgia Southern University and its student body. And so what we're wanting to do is to be able to survive the next couple of months. For us, the border regions have deemed that there will be no summer classes, so we're looking forward to getting the students back in the fall. And so what we want to do is, over these upcoming weeks and months, make sure that our local businesses have the resources and support to be able to survive over the next upcoming months. And then in the fall, when the students are able to return, a little bit of normalcy can come back to the community, where individuals are out in the community spending dollars with local businesses, and making sure that our economy gets back to where it is. I believe that the stimulus package that has been passed down from the federal level is a great tool for those that's down at the local level to be able to utilize and be able to fill the void. But we are also looking at what other measures we can do locally that can save those businesses. That's extremely important to our community. In DC, someone may not know how important 3 Tree Coffee is to the city of Statesboro, but we know that, and we have to put in the infrastructure to be able to do so.
For sure. What about you, Representative Saines? What are you seeing in Camden County in terms of projecting 30, 60, 90 days in a year from now?
Sure, and I think we're going to get just from this response is going to get probably worse and more strenuous before it gets better. And I think you're going to see additional either keeping those restrictions or possibly adding to those in the next few weeks. But my biggest worry long term will be how we, after we get through this, how our local economies do react. St. Mary's, Camden County is a little bit different in their reliance on a few key installations and Federal Park, Cumberland Island National Seashore, which I think is the only closed beach on our coast. They are those businesses, as soon as the CDC put in the requirement to 10 or less folks, that the Park Service shut down that ferry to get to it. So those downtown restaurants and hotels have probably got the biggest downward V in their businesses, and to a point, and that CARE Act will assist them. I think everyone that I've talked to down there applied for either the PPP or that modified recovery grant through SBA. But will that be enough, or what do we need to do to make sure when we are able to reopen that they're able to flip that sign up and have those employees there?
Absolutely. Jared, from the chamber perspective in Savannah, what are your predictions, if you will?
well, one of the things, we also operate the Visit Savannah. And so what we've done with Visit Savannah, of course, is our team is already starting on the campaigns to get our visitors back to Savannah and Chatham County. And with our economy largely based on having the visitors and stuff like that, our businesses and our restaurants and our hotels were quick to honestly have to shut down because people weren't coming. And so we're hoping to get the visitors back, which will get our businesses back open. So we're focused on that right now. We're taking several different approaches. So when we do bounce back from this, we'll flip the switch and hopefully turn the spigot back on and get our visitors coming up from Florida, stopping in Stevens area, getting gas, stopping in the mayor's area, getting gas, and then coming in Savannah and spending some money.
For sure. So,
Suzanne, could I add one more thing to that, if you will? Keep in mind, we've done 3 relief packages thus far in Congress, and all of them have been aimed at making sure the health of the citizens has been taken care of. There is discussion about having a 4th phase, about having a phase more aimed toward the economy. Now, I just got to push that the Senate adjourn without having approved the $250 billion that extra that the president had asked for the PPP program, the payroll protection program. Evidently, it's tied up, if you can imagine this, in politics, and the other side wants to add some things to it. But nevertheless, if there is a phase 4, this could help our economy. And I will be quite honest with you, before we pass a phase 4, I want to see how phase 3 does. Phase 3 is primarily aimed at, first of all, making sure we keep liquidity, making sure that our small businesses can stay afloat, making sure that they continue that employee-employer relationship. What has been floated as a phase 4 has been perhaps an infrastructure bill. That could possibly help our economy. It could help our rebound if we have an infrastructure bill. Keep in mind, infrastructure is bipartisan. Democrats, Republicans, old, young, everyone needs infrastructure. So that may be something that helps us with our economy and our rebound as well.
Absolutely, that's encouraging to hear. And next week's call is specifically on regional impact to our local economy, and we'll talk specifically with folks from Tourism Leadership Council and folks that live in that world. So that's encouraging to hear. One of the things I want to ask about is, some of our headlines this week talked about the numbers in New York, sadly exceeding the lives lost from 9/11. And when we think about our world post 9/11 and all of the changes that we saw to day-to-day life, whether it be as we travel, the TSA screenings, or protection of a cockpit on board an aircraft, so much changed in our world. What do we anticipate being some of our new normals going forward? Do we anticipate seeing some day in, day out changes to life? And frankly, how do we prevent this from happening again? Congressman Carter, you want to jump in on that one?
Actually, I do. I hate to dominate here, but I heard Dr. Fauci said that we need to start thinking about shaking hands and whether that's going to continue or not. I hope he's wrong. I mean, this is my home. I'm from the South. I'm from this area. I was born and raised here. I've lived all my life, and shaking hands and hugging is part of our culture. And I hope it doesn't go away. I hope that, and I get it. I know, where he's coming from. I know what they're trying to avoid, and especially being a healthcare professional, I get it even more so. But I just hope those kind of things don't go away. I know that life's never going to be the same again. You're right, and he's right. But again, as I said earlier, there was no playbook for this. I mean, everybody's saying, "Oh, why didn't you do this? Why didn't you do that?" Well, who saw this coming? Who knew that we were going to be faced with this? We didn't have the proper platform to have the test out there. We've got it now. We're much better prepared. When this happens again, we're going to be in much better shape, and we will handle it much better. I don't think it will be anything like it is now.
Let's hope not, right? Mayor McCullough or Representative Saines, are you anticipating any changes to our day in, day out life from things that you've seen in your communities as a result of the pandemic?
I'll chime in just a little bit. I think that COVID-19 is going to change a lot of things across the country. And it's kind of like what Congressman Carter said. You know, we didn't see it coming. You know, living in this area, we prepare for hurricanes, we prepare for tornadoes, we prepare for things of that nature. But more than that, I think that what COVID-19 has done for us is that it allowed us to see some of the weaknesses that we have in our social infrastructure, as well as areas that we can look to improve. And what my hope is that once we get to the other side of this, we become communities and a nation where we recognize that there's some things that we're going to simply just have to invest into. And that investment is going to have to be into healthcare. It's going to have to be into technology. Because what I see is that coming out of COVID-19, the workforce and how it's executed is going to be redefined. What we're seeing now is that a lot of us are working from home, and we're still getting the job done. And I can tell you, one of my great concerns is traditional institutions that may be changed as higher education. Right now, our brick and mortar institution, which has a $1 billion economic impact, is now providing all of its services online. So those are some of the things I think we need to look at. We need to figure out what does this look like in the future. But more than that, I think that on the other side of this, we will be better and stronger because of it.
Absolutely.
And I'd
Representative
add just on, sure, I'd add on a practical standpoint. You know, our company I'm with, we've had to invest a good bit of money to get us to telework and get our staff trained on those, whether it be conference calls, whether it be paying for a cloud system. I think many businesses are doing the same, and you're going to see, you know, those investments have to be utilized after this event. And I think you're, you know, for better or worse, an increased use of those platforms to mitigate whether it's in-person travel or, you know, daily working in an office. I think that's going to be something that we're going to see statewide. And you know, almost all agencies in the state of Georgia are teleworking and have been for the last 3 to 4 weeks. Given the increase in workload, I think they've performed admirably to that, and they're doing that without in-person tools. So can we create to where those economic impacts and having Atlanta as the state capital, can we have virtual sub-administrative capitals that have been done in other states to increase employment in areas of our state that need it? So I think that there will be good that will come out of it. I think we've been resilient in every national emergency, and after we get through this, there'll definitely be some positives. As much as my mother would be upset with me if I said that I'd be happy not to hug folks after that, but so I echo the congressman's cultural implications, but I think there's definitely going to be some good to come out of that.
Well, and you also talked about teleworking a little bit. And so that's something that I know the calls that I've been on and meetings that I've had that used to be just a conference call, and now we're doing Zoom and GoToMeeting, and we've got so many video conference calls. Do you think teleworking is a new trend that is here to stay regardless of what happens with COVID-19? Jared, what are you seeing? Do you think teleworking is here to stay?
So real quick, back to the previous question. Probably, well, at some point I would say so, yes. And I want to go back to the previous question, not to make light of it, but I doubt any of us who live through this will ever be caught without an excess of toilet paper in our closet. So, but no, I think teleworking now is going to be part of the future in some form or fashion.
Absolutely. So we've all had to figure out how to work differently. And, you know, one of the things that I know in my world of human resources we've talked about in various settings is just the humanity that it lends to different calls. People are trying to have a serious conference call about serious matter, and there's a child climbing on the lap, or the dog is barking, or, you know, somebody's siblings are having a fight about homework and whatnot. And it lends an element of humanity. Do you think that trend is something that we continue to embrace as we go forward as just a normal part of working, that it becomes working from home?
Suzanne, if I could chime in on this, one of the things that we've run into in Congress is we don't have we don't have a way to vote off premises. We can't vote electronically. And in order to do that, we'd have to change the rules. In order to change the rules, we have to be there physically. So it's really been a challenge. And that, I suspect that that'll be one thing that we'll look at. But to your question about, telehealth, and I guess I'm kind of the senior statesman here on this call, and it's changing. There's no question about it. But I think it's changing for the better. I think all of this is good. We're going to learn some very important lessons out of all this. And I think it's going to make us much better as a country, much better. I think it's going to make our economy better. One thing I want to mention, because this is very important, at least in my world, back in the late 70s, when we recognized that we were too dependent on the Middle East for our energy needs, and that we were too dependent on the oil there, we recognized that in order to have national security, we had to have energy independence. Now through this, one thing that we have recognized is that we're too dependent on China and other countries for our pharmaceutical needs, and we need to have pharmaceutical independence. Therefore, I'm sponsoring legislation now, working with Senator Rubio's office to have legislation that will repatriate some of these pharmaceutical manufacturers back to America, so that we are not as dependent on foreign countries for our pharmaceutical needs. 90% of all of our antibiotics, of all the ibuprofen and a lot of vitamins are coming from China. That's not a good situation for us to be in. So I do see a lot of good things coming out of this, an awful lot of good things.
Great. So I want to jump back to something that you mentioned earlier, Congressman Carter, the delegation to the states about decision making. And we've certainly seen some issues here where mandates from the governor and local mayors disagreeing with some of those mandates. How do we, and I'm speaking about the Tybee Beach situation specifically, but I'm sure there are other instances, and maybe Mayor McCullough, you've experienced this as well, but how do we navigate these situations where we've got a state mandate that local communities say is not right for their community, and they disagree with that? How do we navigate these situations productively?
Well, as a former mayor, I can tell you, I like decisions being made at the local level as much as I can. I think the governor did a good job of holding off as long as he could before he put the statewide shelter in place. It made sense. As he said in a couple of his earlier press conferences, what's good for Hoboken may not necessarily be good for Atlanta. What's good for Albany may not necessarily be what's good for Nahana. And that does make sense. But at the same time, I think his decision to put a shelter in place for the whole state was probably the right decision. We did have some trouble with the beaches and a little bit of controversy there, but thus far it looks like it's worked out okay. I don't think we're having people congregating there, and certainly having access to those important public areas is important. At the same time, again, I was a mayor in another life, and I understand Mayor Sessions and where she's coming from, and that's one thing you have to keep in mind, is the impact that your decisions are going to have on the local communities, especially as you get further up, and that's certainly something I always try to keep in mind at my position now.
Sure. Mayor McCullough, what's your perspective on that?
Well, I guess kind of piggyback again off of what Congressman Carter said. As mayors, we like to have the ability to do the things that's unique for our community. But at the same time, there's a balancing act. We're trying to balance how do we save lives and save our economy at the same time. And so I know that's a difficult decision for us at the local level. So I can only imagine the amount of pressure that's associated with this decision that's coming out of the governor's office. One of the things that we were extremely fortunate about in our areas is that whenever we try to create policy, we try to take away the emotion and just try to think about what is the best route for us. So as we did our state of emergency and began to do our executive orders, what was comforting to us is that as our orders came out, they pretty much mirrored exactly what was coming out of the governor's office. So we felt that put us in a position to believe that we were making the right decisions. And so when his shelter in place was executed, you could have literally taken exactly what we were doing in Statesboro and just expanded it across the entire state. Because many of the same businesses and measures that we were taking locally are the exact same things that was coming out of the governor's office. But again, we have to prepare to save lives today, but we got to also think about the economy that's going to come post COVID-19. So right now, the only thing that we can do is pray for God's wisdom and hope that we're making the right decisions. And then at the same time, hope people understand that this is a situation that none of us that has not happened recently since the Spanish flu in America. So so we're living in an unprecedented time. And I think everyone is trying to make the best decisions for everyone across the board.
Absolutely. So here's a question that's more of a personal question for each of you. And Stephen, maybe I'll come to you first, but I want to hear from each of you. Just, there's so much to process right now, and we've acknowledged so many times that this is totally unprecedented, the world that we're living in right now. Nobody could have foreseen this coming. What are your biggest fears right now, and what's the biggest thing that gives you peace right now? Stephen, can I come to you first?
Yeah, sure. And I think it goes back to a previous question. I think we've kind of been big picture on this, and we've looked at the economy. I think we're lucky to not really be fearing the worst of this and what other countries have, and what other local areas in New York and other areas is if this problem really becomes a hotbed and we really do stretch our public health and our hospital systems, we are at a pretty bad situation. It's never good when the best you can be worried about is folks' paychecks and businesses, but the worst we could be worried about is true unnecessary deaths because of this. So, my biggest hope through all this is our state shelter in place and state of emergency is reliant on every citizen and businesses truly being entrusted with acting responsibly. So I hope that as these weeks continue, that voluntary and leadership from our businesses, from our citizens, continue to the level that they need to be to mitigate this crisis. And I'll say on a personal note, I did take my 5-year golf clubs that were unused to the office when I was working alone, and that was kind of my I've been working on my swing every now and then as a break. So that's probably the personal addition to this schedule.
Nice. Jared, what about you? In your role at the Chamber in Government Affairs, you're kind of an in-between conduit. And same question to you. What are your biggest fears right now about what's bringing you peace?
Well, honestly, I'd have to say, biggest fear is, this lasting for a prolonged amount of time. But hopefully that's not what's going to happen. And a lot of it that brings me peace is, and I'm going to brag on the staff with the Savannah Chamber and Visit Savannah. We've all come together, even though we're working remotely, working together better than we ever have to disseminate the information to our members and to the business community in the Savannah area. But also, we've stopped and we're picking up the phone. We're calling all 2,000 or 2,200 members, checking on each of our businesses, saying what can we do, what needs to be done, what are your concerns. And so we're taking the time and just contacting all of our members and talking to them what their concerns are, what their immediate needs are, and if there's anything that we can do, kind of needs, if we can point them toward Congressman Carter or Stephen or anybody else, or the governor's office, to give them assistance that they need. That's what we're doing. So I'm seeing, and I'm sure this isn't just unique to our staff, but I'm seeing our staff pull together to honestly for the greater good of the organization, which is the greater good for the business community.
Nice. Member Caller, how about you? Same question.
The biggest fear that I have is that we go back to business as normal, as if we hadn't learned anything through this experience. I think that there's some things that's been exposed that at this point, regardless of your politics, should be universal. I think that, I think the conversation in and around healthcare should be changed dramatically at this point. I think the things that we know that we already agree on, like infrastructure, we need to go ahead and move on those things. But to expand infrastructure, to understand the importance of getting that Wi-Fi ability to many Americans, regardless of their location. The thing that's bringing me peace is that I'm now able to spend more time at home with my kids. That's the biggest thing that's bringing me peace. You don't realize how much you go until you're not going. And I, last night I had the opportunity to play Scrabble with the kids, and so that was a big deal because it had been a long time since we've slowed down enough where we can sit down as a family, and just play a simple board game. So that's what's bringing me peace. But my greatest fear is that we go back to business and politics as usual, and we don't learn the lessons from what we're experiencing right now.
For sure. All right, Congressman Carter, how about you?
Well, as you said, personal, and I've already expressed my personal biggest fear, and I'm serious. I mean, shaking hands, hugging, all that is just such a part of our culture down here in the South, and I just hope we don't lose that. But seriously, and I am serious when I say that, but yeah, it is important we learn our lessons, and I think we will. I think that out of this, we will learn some very important lessons. I serve on the Energy and Commerce Committee and on the Health Subcommittee, and I can tell you that we are the ones who are responsible for making sure that our pandemic response is in order. I probably shouldn't have said that since we were a little bit behind on this, but nevertheless, we are already working on things that we should be doing in order to prepare for this in the future, and we will continue to do that. That's very important. But I want to say this. Yeah, this has been tough, and we still got tough times to go. We're not through this yet. We're getting through it, but we still have some rough times ahead of us, so we need to keep that in mind. But what I've witnessed all throughout the 1st District of people volunteering, people coming together, people volunteering at the food banks, making sure that the social services are there, our nonprofits, making sure that the food banks, making sure that the homeless shelters, people reaching out and the community coming together. That's what's been so inspirational to me. Yeah, we've been through some tough times, but I can honestly say that I've seen America at its best. I've seen the 1st District at its best. And I've seen us all recognizing that we're all in this together and that we need to be looking out for each other and checking on each other and encouraging each other. So I see a lot of good things coming out of this.
Nice. Thank you all for sharing that personal perspective. Looking optimistically, and regardless of what the time frame is, for when things start to slowly return to normal, when businesses are able to start to reopen, I know I worry about calendaring all of the things that we missed, and now we got to add them onto an already busy fall calendar, assuming that's when we can. But what do you anticipate that process will look like? I can't imagine we just send the doors wide open and everything is back to normal. And could that trigger another surge? What is your anticipation of what that process might look like as we start reopening businesses and schools and whatnot?
I think you make a valid point. I think we've got to be very careful. We've got to make sure that we don't have a relapse here. Quite often that does happen. And I don't believe any of the news I get out of China. So I can't trust that, but I think that they have had some relapses there. And if we try to bounce back too quickly, then we're going to run into problems. So I see the administration really taking and Congress really taking a gradual approach to this. We'll see certain regions that are peaking quicker and sooner than other areas. Those regions, I think that you'll see those come back online, if you will, before other areas. We're predicted in Georgia to peak around April 20th, and I think New York and Louisiana, maybe Washington State, the hot spots now, Michigan, they are already peaking. So they may come back a little quicker than we do, only because they peak quicker than we do.
Sure. Representative Thames or Mayor McCall or Jared, either of you, and if you want to weigh in on that, what you anticipate would happen as we start returning to business as normal-ish?
I'll go ahead and add, and it kind of correlates to a local request from Camden County, which was when I asked what do you need advocacy for, they really wanted data from Department of Public Health for the testing, the positive testing, to be aggregated down to a zip code level, which there's some issues with right now. That kind of information is crucial when we talk about when we reopen and how we reopen. I think that it does need to be, like Congressman Carter noted, data led, and where can we open what. we know that rural areas, to its advantage, are not as impacted. Low population density communities are less impacted by a lot of the issues that the hotspots. So I see probably a transition from how we got to here, from going from a locally led approach to a statewide locally restricted approach, probably back down to phasing out the state requirements and instituting localized requirements because of where those hotbeds are. But to do that, we definitely need to have sound data so that those strategies can be implemented, and of course, hopefully not too soon.
For sure. So as I look at our questions from the class, I think we've touched on all of the questions, great questions from the group that we've woven into the conversation, except for one. There's one fairly specific question here I want to go ahead and make sure it gets asked. So let me just read what that question is. State and local usually have unfunded mandates. If more responsibility is put on state and local, how do they pay for decisions made, especially in low wealth counties and towns? Anybody want to take a stab at that one?
Somehow I feel like I'm the target of that question, but nevertheless. Okay, guys, we've already allocated and appropriated $2.5 trillion. So that's quite a bit of money, but I do get it. Again, I was a mayor at one time, and I hated unfunded mandates. I hated the situation. Let me assure you, and I say this from a bipartisan viewpoint. Congress is wanting to make sure everyone's taken care of, and we have in a bipartisan fashion. We get it. If you look at what we've done with the small businesses, if you look at what we've done with the individual paychecks that people are going to be getting, I think we've really done an outstanding job of making sure that people stay liquid. What has happened here is nobody's fault. This is unlike 08 and 09, when you had bad business practices that resulted in us having to bail out companies. This is not anything like this. This is something that none of us could control, and we recognize that in Congress. And yes, there are going to be instances where the local and the state governments had to fund something that we didn't know they were going to have to fund. I'm not going to say that in every instance we're going to make up for that, but I will tell you that we will do our best.
I'm going to add to that. I figured the mayor was going to be the first one to comment, because I think there's a quote that unfunded mandates roll downhill. With that, I think you're one of the local counties who've called me after the shelter-in-place order and the clarification that sheriffs really are the local executor enforcer of that shelter-in-place was, I don't have the deputies. I have 5 deputies, and 2 of them are at home and due to exposure. How do we enforce that? And I think definitely the state law enforcement has been supporting, but that's just one very small example of an unfunded mandate to the states. And I'll say this, we're going to have a very stark conversation on a state level when we do get back into session. Of course, we're suspended indefinitely throughout this emergency, but the numbers that are going to come in, we're definitely very connected to the sales tax of our state, which is you don't need to wait for that data to come back to know that's going to be impacted. So what are we going to have to give up? Georgia's the 3rd lowest in per capita spending in the nation. So there's not a lot of fluff in the budget. Governor Kemp was very proactive in adding to requesting some reduced funding early on in the current fiscal year, and I think we're going to be in a better position. But things that I would have never thought weren't going to come in through this session, like the teacher pay increase and possibly the income tax reduction that was being talked about. Those are going to be things that are likely not going to make it through. And what else? How are we going to balance that loss? And definitely, I'm sure, supporting the local efforts and the increased costs there. Probably that's going to be the biggest issue, and I'll let someone who knows about that talk about.
So it sounded like Mayor McCollar had a specific instance that Representative Saines alluded to. Did you want to chime in on that, Mayor McCollar?
Well, at the end of the day, I think many of the things that we receive in life is unfunded, right? But with that being said, you have to figure out how do you make things happen. And I think during this time period, like I said before, this is an unprecedented time. So when the governor came, made his mandate, what we did immediately was to have our ordinances and our policies mirror exactly what the governor is already doing. And so what it allowed us to do is to use tools that we already had at our fingertips to be able to have the power to address those issues. And for us, that's our code enforcement and law enforcement. So now the plus side of this is that we are now, since we are in a state of emergency, any overtime funding any overtime that's needed for those officers will not be reimbursed back to the city. So those are some of the things that we're looking at as far as being able to support those unfunded mandates. But at the same time, I think it's critical for us to be able to identify resources to help support those during times, especially like this.
Absolutely. Thank you, Mayor McCollar. And I know we're at our time, and I know Congressman Carter and probably everybody's got the next call waiting for them. So I want to be respectful of everyone's time. So thank you so very much. I know we've got a few more questions that have trickled in. We could probably talk for much longer, but I want to respect your time. Congressman Carter, Mayor McCollar, Jared Downs, Representative Saines, thank you all so much for being with us today. We really appreciate your insights and your honest dialogue. And thanks for the class for chiming in with all these great questions. We appreciate you all. Thank you. I know y'all need to drop off if you need to. Thank you. And to the class that's joining us live, just a reminder that next Thursday, same date and time, Thursday at 11, we'll have another session, and we've got some regional representatives talking about specific impacts and trends they're seeing to our economy here locally. So appreciate you all. Thank you so much. This will be made available via video to our alumni and to our board members and sponsors. And thanks so much, everybody. Hang in there. Have a great Thursday and a happy Easter this weekend, or a happy Passover if you were celebrating. Thank y'all so much.
Thank you.
Thank you.
Y'all, bye.